Hi, my name is Karen E. Wells and welcome to this Holistic Pain Management course. We're just about to move into Module 1, which is all about what is pain. But first of all, I just want to talk about the training manual before we move into that. So the training manual is an essential part of working alongside these video modules so that you get the most out of this training course. Now, if you're using the Udemy app, it might be that there's an issue that's stopping you downloading the training manual. If that's the case, then I would recommend that you go to a desktop computer and actually download it there for yourself so that you can print it off or just have it for your reference. Or if there's a problem, just drop us an email and we'll send you a PDF of the course. So let's move on to Module 1, which is all about what is pain. It's important for you to understand that if you're looking at pain for yourself, if you've suffered from chronic pain, or if you're looking at helping clients of yours heal their own pain or really start to look at what it is that's causing that, then you really need to know what is pain. So this module is very in-depth and it's going to go into that exactly. So this video module is about to turn into some slides and we'll work through the rest of this video module of what is pain. So if we look at what pain is, it's something that we all experience from time to time, sometimes without warning. It's always an unwelcome and unpleasant addition to life and can limit, of course, physical movement, affecting the quality of life and have a detrimental effect on how people think and behave. So we often think of it as a warning sign, an indicator that something's wrong, and use it as a way of protecting ourselves. Specialized nerves within the bodies detect and warn for any changes that occur in respect of pressure, chemical imbalance, and even temperature. These are known as the nociceptors and they send alerts to the brain, and it's important here to note that feelings of pain are not sent to the damaged area, but that they come from the brain. So when you injure an area of the body, the pain that occurs is a result of the information being analysed by the brain, and this includes cognitive data, danger data, beliefs, and sensory data. So the brain produces the feelings of pain as a warning. It's there to prevent movement, it signifies that rest is needed, or that you should seek medical help. So you might surmise that pain therefore does not exist within the body, but this would be incorrect because certainly these nociceptors are in place throughout the body and they become the first line of defense that trigger an early warning system. As such, the brain's then alerted and the mobilization of the inflammatory mechanisms are triggered. These increase the blood flow and release healing molecules from the relevant tissues in the bid to start the healing process. Now, during a local anaesthetic, if these nociceptors are rendered as useless, alert messages are not created. This means that even when there's major tissue trauma, there's the potential for the individual to not experience any pain. If the inflammation is present, they become ever more sensitive and can even respond, creating alerts even when there's no actual danger. So the brain is complex, and if we really wish to comprehend how the pain equates to the conscious mind, we really need to understand more about consciousness itself. In a nutshell, it's perhaps wise to say that where there's evidence of danger, there will be an increased protective behaviour and perhaps, as a result, a greater intensity of pain. So where there's evidence that the body is safe, there's likely to be less pain. When it comes to chronic pain, sensitivity increases, so there's often a distortion between the pain and the need for protection. So by this, we can reason that there's no quick route to the management of pain. We always consider a recovery process which depends on the pain and the health condition, while including patience. So this module is very in-depth. We're looking at neurons, we're looking at the networks, including the neurotags within the brain cells. So it's very important to read the training manual to really cover all of this. So pain can be divided into 3 areas: sensory discriminative, effective motivational, and cognitive evaluative. We talk about the sensory discriminative and how that's relevant to the detection of pain, to the location of pain, and to the intensity of pain. We look at the cognitive evaluative, which is the conscious interpretation of the pain alert, and is combined with additional sensory information. We look at the sensory discriminative, which becomes less distinct and leads to less localized pain. So this is all covered in depth in the training manual. There's also a number of tasks at the end of this module, so make sure that you really spend some time to go through those, and we'll see you on the next one. So that brings together the end of Module 1. At the end of Module 1, you'll see in the training manual that there's some self-assessment tasks. Now they're purely just for you to complete. You don't need to print them off or email them over to us. They're just for your own reference. Once you've done that, I'm looking forward to seeing you on Module 2. Have a great day.